Welcome to Dateline Schools, a presentation of the St. Clair County Regional Educational Service Agency with your host, Terry Harrington.
Welcome to Dateline Schools. A top priority for any community is the health of its children. And in our community, there is one unique way local teens have access to health care, and that's through the Teen Health Center in Port Huron. To tell us all about this well-kept secret in St. Clair County, my guest on Dateline Schools is Medical Director for the St. Clair County Health Department, Dr. Annette Mercantant, as well as Health Center nurses Amy Bishop and Sandy Mangan. But before we begin our conversation on the Teen Health Center, let's tune in to this education update.
Thank you, Terry. The RCCRESA Administration Buildings is once again participating in the Homeless Adoptive Family Project this month. Employees were asked to help the less fortunate in the community by contributing cash or making payroll deductions. The money is being used to buy gifts for families in 4 St. Clair County homeless shelters. RCCRESA's Homeless Program Coordinator, Lauren McDowell, will distribute the gifts shortly before Christmas. Tech and Woodland employees are also getting in the holiday spirit by sponsoring their own charity initiatives. The St. Clair County Community Foundation awarded almost $14,000 to the St. Clair County Know How to Go initiative. Know How to Go will put the grant money toward its mission of increasing the number of local graduates who continue their education beyond high school. Among the items that will be paid for with the grant money are ACT prep books, ACT practice tests, and college survival kits. The survival kits will be given to each high school junior in the county to help them organize all of their college materials. Grant money will also be used for a college planning workshop and college campus tours for large groups of students. In other grant news, Woodland Developmental Center was the lucky recipient of a $2,500 gift from the Special Olympics Michigan Project Unify. Physical education teacher Jen Egan applied for the grant, which gives money to schools and organizations for promoting unified sporting events. Unified sporting events are games and activities in which students with developmental disabilities join forces with traditional high school students. Woodland's first unified sporting event is a bowling and basketball tournament that takes place in March at Western Michigan University. RCCRESA's Education Service Department recently gave 5th graders the chance to discover their musical interests. The department sponsored a concert by the Port Huron-Sarnia International Symphony Orchestra at McMorran Place. The annual concert introduces students to orchestra music and helps them decide whether they'd like to play in the school band when they reach middle school. The concert features each section of the orchestra, such as strings, brass, and percussion, so that students can determine if they are interested in a particular instrument. And finally, winter break is almost upon us. All county school districts are on the same schedule for break this year, which begins on December 21st and ends when students return to class on Tuesday, January 3rd. On behalf of all of RCCRESA and Education Update, this is Christian McGeechee, wishing you a happy holiday season. Terry Harrington and Dateline Schools will return in a moment.
What gets you moving?
Because when you get moving an hour a day,
You fuel your body,
and your mind.
whether you like to throw around the football.
play frisbee in the park,
Or dance in your room.
Moving every day helps give you a healthy body and mind.
And that makes you part of a winning team. Hey, that was my line. Get up and play an hour a day, Doc.
check out how to be a player at letsmove.gov.
Head online to get tips on great ways to get moving every day.
That's www.letsmove.gov.
Welcome back to Dateline Schools. It may be one of the best kept secrets in our county, but it serves a great purpose. So on this edition of Dateline Schools, what we're going to be talking about is the Teen Health Center with my guest, Dr. Annette Mercantant, the Medical Director for the St. Clair County Health Department, as well as nurses Amy Bishop and Sandy Magnan. And ladies, welcome to the program.
You're doing really good with that name now.
Great. We've been doing this a little bit and we've had some fun, haven't we?
You're doing very well.
So Dr. Mercantant, what is the Teen Health Center and how long has this been in existence here in our community?
Teen Health Center has been open for over 20 years, Amy. I believe it's since the 1980s. We got a new facility 2001. But it's primarily a primary care and preventive medicine clinic for adolescents and teens from the ages of 10 to 21.
I mean, this really is a well-kept secret in our community. Not a lot of people probably know about it.
We don't want it to be a well-kept secret.
Well, that's why you're here.
That's why I'm here. We think it's a wonderful facility. Just like everybody else in our community, there are a lot of people who fall through the cracks that, for whatever reason, don't have access to health care. And in particular, our teens have specific needs, and this clinic, we think, fills that gap.
Is this just geared for kids? Basically,
yes.
What age groups?
10 to 21.
Okay.
10 to 21. So obviously there's a difference between the 10 and the 14-year-olds and maybe the 15 and 21-year-olds, but we're kind of prepared specifically to look at those age groups.
Okay. Sandy, where is the Teen Health Center located?
It is on the grounds of Port Huron High School. We're kind of tucked back into the corner or behind by the baseball fields and the tennis courts.
Has it always been down in that area?
Yeah,
Yeah.
I think so.
Yes, we actually started out as a module building, but
Okay.
now we have a nice brick building.
Now, usually when you think of something like that, you think, it'd probably be mostly girls that would go to it, but it's really open to both guys and gals, right?
Absolutely.
How many kids do you service a year?
Well, the unduplicated number, which means the new clients that come, is usually ranges from about 1,500 to 2,000, and then anywhere from 3,000 visits altogether.
Have you seen the number of people coming in for health reasons kind of increase or decrease? Has it been pretty steady over the years?
I think it's been pretty steady. We'd like to see more students use the facility. We feel that it's underutilized, but definitely a good thing for the kids.
What are the goals of the Teen Health Center? What are you trying to accomplish with this?
Well, you know, we feel very strongly that this is a great age to intercede and intercept health behaviors that are risky, early disease states that are easier to treat, to immunize and use preventive strategies to keep them healthy and get on to college. It's a great age to start making those differences because they're just starting out in their lives. So we take a lot of time and we take a lot of pride in the fact that we're just not seeing a sick kid for a sore throat and off they go. Every child really gets a good preventive health screen when they come through. We try and establish relationships with them so they feel comfortable talking to us and coming back.
Do you find that once a student comes in and sees you, you're going to keep them for a few years?
I would say most of the time. I think most of our kids really are left, and our parents too, leave thinking, surprisingly, I think that this is a very comfortable place for them to receive their care.
Amy, what are some of the services you provide at the Teen Health Center?
Well, that's Sandy.
Sandy.
But that's okay.
We provide all kinds of services, really. Primary care, so any sick visit needs. We do preventative visits related to any kind of disease, really. I mean, and if it's something that we need to refer out to the community, we're referring back out to the physicians in this area.
There's mental health screens. We do sports physicals, immunizations. You think really adolescents are prone to just about everything the adults are, but
Pretty much what a normal pediatric office would do.
yeah.
Do you also work with a lot of the pediatricians in the area that if you see something, you make referrals?
We do, and I want to make that very clear. We're not here to take patients away from other primary care physicians. If these adolescents have primary care physicians, we try and reconnect them with them. We pick up the phone and we talk to them frequently and find out what's going on. If they don't have health care, they need it, we get them hooked up with it. So we work hard to get them into the right place, whether it's with us or with somebody else.
Okay. Amy, Is it just the three of you basically that staff this, or do you have other staff that work with you too?
Yes, we have one other RN. I also serve as the RN myself, and then we have 2 clerical staff as
So
well.
what is your role mainly?
My role, I'm the coordinator of the center, so I'm responsible for ordering supplies, turning in some state reports, and also I do direct clinical care as well. So kind of do everything.
And she does a lot of our outreach too. Amy spends a lot of time talking to the schools and making sure they're aware that we exist and filling those gaps. Sometimes they'll call and say we have this need or this interest, and Amy will develop programs and responses to those
Right,
needs.
the educational programming, I pretty much schedule and set up and then go from there. But
Sandy, how about you?
My role there is I'm one of the providers, so I will see all the kids that come through just as if they were seeing a physician, being a nurse practitioner, and then support for the education programs or outreach as needed.
And case management.
Case management.
Yeah, that's
We
pretty
do a
important
lot.
piece
We
of
do a lot of hand holding. We do a lot of, probably more so I think than a lot of other offices can really do. We make sure that patients go and show up to where we've asked them to go, and we call back and make sure that they've followed through with what they've said they were going to follow through with. Doesn't mean they always do it,
Sure.
but that takes a lot of extra time as well. These guys do a lot of that.
So I imagine with this clientele that you service, just that personal time probably is as valuable as the health care you provide as well, isn't it?
Well, I found that this age group doesn't always know how to respond. When you say what's wrong, they don't have the sensibility perhaps that you would say, well, I have this headache and it started on this day. It really takes a lot of time to get them to tell you what we need to know. Yeah. We call it the onion. You know, they start out with something, and then as we peel away those layers, we find out many of the things that we really do need to know to make a good decision.
And my guess is too, with the services you provide to those kids, that really has a big impact on their academic careers too, doesn't it?
Well, a sick kid doesn't make a good student.
Sure.
And I know truancy is one of those issues we'll hear from the schools, and they'll say, you know, we're having trouble, this kid's not coming to school. And, you know, frequently, to getting to the bottom of that is the difference between making them succeed and not. So.
How is this whole thing funded? Especially, you know, we've heard so much the last few years about healthcare and the cost of healthcare. We're providing something, so how are we paying for this?
It's very challenging. Teen Health Center has traditionally been funded through a variety of resources. We receive a competitive grant through the state that funds a lot of school-based health clinics, health centers. We also receive some county appropriations and some funding through revenue. You know, we try and bill and collect as much revenue as we can. It has become quite challenging to keep the Teen Health Center not only going as it is, to keep it growing in the direction we want it to grow.
Now, talk about that growth. Where would you like to see this go?
I'd like to see this be accessible to every adolescent in the whole county, and those even outside of the county that have the need. I mean, this isn't something that's available to everyone. We see a lot of the kids are from Port Huron High because we're right there, and we know that many kids, even though they know they should see somebody, they're not going to get on a bus and go across the county to go see someone, or even maybe ask for a ride. So that accessibility issue is key, and we would love to see these kinds of clinics throughout the county, maybe even on every high school campus.
I know as a dad, I've had a couple of my kids come in for immunizations, sports physicals, that type of thing. It really is a great service to the community. And so what can the community be doing to help you guys do your job?
We talked a little bit about that. Amy, you want to start?
Sure, well, we always appreciate donations, of course. But in addition to that, I mean, those health needs that are out there right now are nutrition and exercise needs. And so anything in the community that would promote bike paths or parks, a safe place to get out and get active, nutrition as far as community gardens, any support like that. And also
safe places for them to hang out.
Absolutely. Yes.
Teens don't have a lot of places to go, I think, that are safe and stimulate their creativity in a safe way.
Right, in a positive environment.
Sure, that's great. Sandy, what are some of the key health issues that you've seen come through your door? Does anything stand out, or is it pretty much just general health care that is needed in our community?
I think a lot of it is general health care. but kid focused. So trying to bring it down to their level, and like we said, trying to find out through the layers of stuff of exactly what it is. A lot of it obviously is nutrition. I mean, and obesity and overweight issues, those kinds of things. And that relates to a lot of health issues we all have.
Reducing risk.
Yeah.
Talking to teens, listening to teens, having that time to spend with them. They don't always know exactly how to say what they want to say, so sometimes it means talking around an issue and getting to it kind of through the back door.
We're actually using motivational interviewing right now. It's a technique that Sandy and I have both been to a conference kind of to learn that method, to listen more and let the student independently guide that conversation and make their own goals, because teens are always looking to be independent, and they need to understand to take care of themselves in an independent way, that they can't ignore safety. So
It's kind of an interesting concept. I think we could apply that not only to the teen health center, but all kinds of areas, can't we?
The problem with it is it takes more time.
Yeah.
Sure.
And many things are not set up right now in our healthcare system to kind of allow that kind of time that it takes to let somebody else tell you their story instead of you just trying to drive that focus to where you think it needs to go.
Great. How does the teen health center also work with parents? I mean, every kid has a parent someplace, somewhere. You know, so how do you guys
love
work
to see
with
parents.
We love them. We strongly encourage parents to be involved and communicate. And some of what we do is role play with the kids so that they're feeling a little bit more confident to talk to their parents. But that's one thing parents can do, is just really stay involved with their kids, keep tabs on them, and know where they're at, and keep them just keep them interested, or stay interested in what they're doing, their sports or their activities or whatever it may be.
One common concern, Terry, and I think this is a good point to bring it up, is that I think there's this perception that perhaps adolescents can come to our clinic and receive health care and the parents would not be involved. And of course, we can't and would not do that. Any medical therapy or treatment requires parental consent or a guardian consent. Now, there's a few exceptions to that in Michigan law. We've gone over these before, but if a child is seeking care for pregnancy, sexually transmitted diseases, mental health, or substance abuse, we can't provide those services without parental consent. But everything else requires the parents to be involved, and we will frequently see the kid and pick up the phone and either try and get that consent immediately, or we'll send them away, which we hate to do until they have it.
Do you find parents are pretty cooperative when it comes to
I would say
helping their kids?
the vast majority of parents want their kids to succeed and be healthy. Absolutely.
No, that's good. So, how about the kids themselves? Are they pretty receptive to the advice that you give them, or they say, "Here's another adult trying to tell me what to do here"? You know?
That's where motivational interviewing is very helpful, because it is a technique to where the student feels more in control of
They're
their
more
care.
connected to it.
Their care.
Yep.
And baby steps.
Yeah.
And baby steps, and earning their trust, and maybe instead of doing a lot of things at once. As you know, they've always said, even adults, when you give them a bunch of medical responses, people retain about 10% of it.
Sure.
So, you know, you really got to give them what they really need to know and then bring them back and give them another piece again, and that works, I think, better.
Now, you mentioned, Amy, you go to the schools and provide some educational programs. Do you work like with the health classes? I think it's what, 9th grade, every student has to have a health class for a semester or something. Is that what you work through? Or?
Well, the programming, as far as the health ed program at the health department, does a lot of that education piece.
Okay.
And then we pick a focus area depending on what the risk assessments that we do. So whatever those students seem to need, when we add up the data, we try and gear our educational programming accordingly. So right now we're working on, our programming includes safe dates, and it talks about maintaining healthy relationships and teaching those students what healthy is and what unhealthy is. Because that's what they're interested in. They're interested in expanding their relationships. So that really kind of pulls them in. And then, of course, lifestyles is our nutrition and exercise programming.
Okay. So. Talk a little bit more about that. What are you doing with that area?
Well, we like to invite guest speakers in. We keep it very interactive. We don't want them to feel like they're just sitting at a desk and learning the food pyramid. We want to
food plate.
They don't like
Change that, yes.
Right. So we bring in, like everyone will bring in a healthy recipe and share that. Or CMH has come out before with their chef, and they taught them how to make Shrek juice, which adds that spinach into, you know, yogurt and milk, because a lot of students don't really like the taste of vegetables. So we find creative ways to get that nutrition in and help them understand that exercise can be fun. We've brought in the YMCA. They've had exercise specialists come out and show us new ways of exercising, such as Zumba dance or yoga or boot camp we did one time. And that interaction and just getting out there and doing it really builds confidence in the students, and that group environment is very supportive.
And everything you've been talking about, I mean, it's so critical to that development of the whole child.
Right.
Because, I mean, these are skills and things that they're going to need regardless of what they do once they get out of high school. And
And they've probably heard it before, but it's the reinforcement, and I think it's doing it in a fun way, in a way that they don't feel preached at. I think that makes a difference too.
You know, just listening to you and watching your expressions, it sounds like this is something all three of you are pretty passionate over too.
Well, you know, not many people know that Teen Health Center is the reason why I got into public health in the first place.
Okay.
That is the secret, is I've always loved adolescent health and started working there part-time even when I was in private practice, and loved it then and I love it now, and I feel honored to have such professional, exceptional staff. These guys love what they do. They're passionate about it.
And you can see, I mean, I can see that here. I'm just having met you, I can really see that.
And the kids feel that too when they come.
Oh, I'm sure.
I think they know that they're really liked, that's really where we're there for.
Do you see this ever going to other parts of the county?
Well, I
other
mentioned
than
that
just behind
before.
Portage Highway?
I would love to see that. The realistic answer is not in the near future.
Sure.
We are struggling. Just again, if there's anything else we could ask the community is to support us, not just financially, politically. You know, there is just a lot of changes now that our budget continues to shrink. And unfortunately, something like the Teen Health Center is not what we call a mandated public health service. This is not something that if we really, our backs were against the wall, we would be able to continue if we had to really focus our resources to just what was required. And I certainly hope never to get there, but we appreciate the support, the verbal and the political support, to let people know that this is something that's good for our community.
Right, and don't keep it a secret.
Sure, yeah, exactly.
You know, I think there is some misperception on what we do, you know, and they think of us as just a crisis center, but we're so much more.
Yeah, definitely not just a crisis center.
Right.
But I imagine you do see quite a bit of that, though, too, don't you?
We want people to know that if they don't know where else to go, to call us.
Sure.
And we will do everything we can to get them to the right place, even if it's not us.
Now, is our Teen Health Center unique to St. Clair County, or are there similar type things around the state and around the country to help our adolescents?
Well, in Michigan, actually, I just came back from a conference, and there are 53 clinical sites, and then there are other models that are out there geared more towards wellness. So it is really a growing idea that we get healthcare, you know, access back in the schools.
And I know, you know, starting next year and beyond, the new health care laws are starting to really be kicking in. Is that going to have much of an impact on what you're doing and the services you're able to provide?
We are assuming it will. There is a lot of aspects of the Affordable Care Act that impact prevention, and there's many things that are very positive about it if they continue to be implemented. But there's a lot of unknowns about how it will directly impact our service.
So I know we've talked about a lot of things, and I'm sure there's areas where people can get more of this information rather than just watching our show here, but where can they get more information about the Teen Health Center and, you know, student nutrition and those kind of things that we need to have?
Well, everybody is always welcome to stop by, take a look around. We provide brochures. We do some televising on Channel 6 of upcoming program dates and things like that. And also we have a Teen Health Center Advisory Board that the public is welcome to. Our next meeting is November 30th. And it's a great way we value the community's input. And it's a great way to kind of know the real intricate issues at hand. So.
And of course you can call. The phone number is 987-1311. Or you can go to the St. Clair County website and you can find a link there as well.
Okay, fantastic. And again, where is the health center located and what are your hours?
We're located behind Port Huron High School, so that's at 2215 Court Street, located right, you would drive in by the pool and the track there. And the hours are, we have late nights on Monday. We start late. We start at 10 and go to 6:30. And then Tuesday through Friday, we're open from 8 to 4:30.
Okay, great. And I know we have just a couple of minutes left. Just want to kind of give you a loaded question. You can all take your turn answering this one. But what kind of last-minute health advice would you like to give to our teens?
Stop believing everything you see on the internet. If you have a question particularly about your health, ask your parents, and ask people who have adults who seem to have some information that's noteworthy. There's a lot of misinformation out there. It really confuses them.
Sandy?
I would say stay active, doing something, anything. We found the more kids that are doing things, they feel better.
Great. Amy, last word.
We took the 2 ones.
Well,
We took the easy one.
Yeah, you did. Well, definitely to not wait till the last minute. A lot of things are solved very quickly, and prevention. If you have questions, don't fear coming in and asking.
I was going to say, my mantra has always been, there is no stupid question except the one you don't ask, right?
That's right.
Right.
And what better opportunity for our kids to ask some questions that are personal. And
We're very
help us.
approachable.
Great. Well, ladies, thanks so much for coming in and sharing this great
Karen.
secret here in St. Clair County. Really appreciate it. Wish you guys all the best in the future. I want to thank you for joining us in this edition of Dateline Schools.